Good morning, everyone. Happy Friday. Welcome to another edition of PT on Ice. I'm Jason London. I'm Ice Core faculty and teach rehabilitation of injured runner, as well as clinical bike fitting. And what I want to talk about today is putting the principle of periodization in your plan of care. Before we get started, looking forward to seeing everyone at the Ice Sampler coming up April 7th through 8th in Las Vegas. If you haven't registered yet, there are a few spots left and we'd love to see you there. But getting back to putting the principle of periodization into the plan of care, I think really resonates with a lot of endurance athletes. And of course, with the Olympics going on right now, you've probably heard a lot of athletes talking about that they've just come out of a good training block and that they feel ready for their event with the Olympics. So what periodization is, it's basically just the phases of a full training cycle over the course of a year or part of a year, so an athlete will be at optimal performance during a key event. So spread out over basically the course of a year, we have phases of recovery, then phases of transition, which would last 1 to 2 months, getting into the base phases of training, which is going to be the bulk of their training, where you're going at a very low intensity and high volume and going anywhere from 3 to 5 months with that, and then getting into more specific training, sport-specific training, where it's a higher intensity, a lower volume, and then tapering right before the event. So that's kind of how it will go for over the course of the year. But of course, we can apply this to our rehab too on a smaller scale, and going from a macro cycle, which would be like the whole year, to more of a mesocycle, which would be a few months, or even a microcycle, which could be a few weeks. And laying that out in terms of strength training, going with kind of more of a base for 2 weeks, where the athlete or the patient is trying to get down the techniques for the exercises with a relatively low load. What we can do here, since a lot of cases you don't want to be going to 1 rep max to just test where their 1 rep max is while they're rehabbing an injury, we can switch to a scale of rate of perceived exertion. And so basically, going at 50% effort for that first week, then progressing to 60% effort, and then increasing the load over the next 2 weeks, where they're more at a 75 to 80% effort, and then one last week of 80 to 90% effort. So really increasing the load or the difficulty of the exercises that 5th week, followed by recovery. A recovery week where they're at 50% or less effort, with probably some more body weight type exercises. And that's really how you can maximize strength gains for your patients. And the whole principle of periodization, it really was crystallized by Soviet bloc sports scientists in the 1960s, so it's been around for a long time. But I think as physical therapists, we've really just started to incorporate it more in a detailed fashion over the past 10 years or so. And I really credit Dan Lorentz for this. He's a physical therapist with a practice in Kansas. And if you ever have a chance to listen to Dan talk, I think he's speaking at CSM this Saturday. Take that opportunity up. So with periodization, again, that's how we're really going to maximize results. And the key component of that is really making sure that you're building in that recovery. So, training and strengthening actually kind of is breaking us down as we're doing that. So it's making us weaker. It's during the recovery phase when we're actually really getting our strength gains. So making sure patients are well aware that they need those recovery phases, and just being aware of that too as you're taking an athlete through their rehab. That a lot of times the tendency is to want to push, keep getting stronger, keep getting better, keep challenging the exercises. but you really need to build in those recovery days or even recovery weeks into their training, and that will allow for supercompensation to occur with their training, so that they'll maximize their strength gains. And a lot of times, it's a little bit counterintuitive to our patients to say that you need to have these rest days and you're going to get better strength gains, but it's well supported by the literature. So making sure that we're doing that so that they're not prolonging their injury and that they're getting the gains that they want. And of course, this is extremely important with recovery days with talking about runners and having them have rest days to try to prevent injury. And finally, kind of one way to kind of really dumb down periodization, I think one aspect that I've really failed at in the past or done a poor job in the past is with the handoff into discharge. In the past for me, especially starting out as a physical therapist, that discharge appointment where you've decided with the patient that it's going to be their last formal physical therapy appointment. You guys are both excited. You've had a good outcome. The patient's excited because they're back to doing what they want to do without pain. You're excited because you have a good outcome. And then you're just there at that appointment and you basically are both excited and don't really set too much of a plan out for them going forward. At least that's how it's been with me in the past. And where I've really, I think, excelled in this is with bringing in some of those principles of periodization for patients at discharge and talking about a plan over the course of the next few months of what they need to do, that they're not done with their home exercise program, that they need to keep it up at the same level, and then depending on where they're at in their sports season, that's when they can kind of bring down and consolidate some of their home exercise program. So for example, if it's a runner that you're working with and they're working on a lot of hip strengthening exercises, once they kind of are getting into the middle of their base period of building up volume, having them decrease the frequency of which they're doing their hip strengthening exercises from basically of 5 to 6 days a week down to 3 to 4 days a week, or even 2 to 3 days a week. And then once they get into that more specific training zone or block, really having them decrease what they're doing in terms of their strength training, maybe down to once a week, just with less effort, kind of that 50% effort or 50% one rep max, so that most of their time and energy can be spent with that sports specificity. Anyways, that's all I have for today. You guys have a great weekend. For those of you at CSM, enjoy the programming. And like I said, hopefully we'll see you in April at the ICE Sampler. Thanks.